What is unexplained infertility? I'm Dr. Sharon Moayeri, owner and founder of OC Fertility. Unexplained infertility can sometimes be a frustrating diagnosis to get. Basically, it means that you've gone through testing and there's no clear explanation for why a couple's having trouble getting pregnant. So what does that mean? You've done screening for hormones, so looking at things like FSH, AMH, screening for thyroid disorders, looking at other issues like tubal disorder through either an HSD, which is a hysterosalpingogram, testing of the fallopian tubes. Also, the male has had testing looking at a semen analysis, and there's no clear reason why a couple's having trouble getting pregnant, and they've been trying for at least 6 months to a year. So one of the reasons why it can be so frustrating is because a lot of times when a couple comes in and they do testing, they're hoping to find a diagnosis that can be treated. Something like endometriosis or, say, a polyp, which is an overgrowth of tissue in the uterine cavity that can be removed. And of course, that's a nice diagnosis to get because if you treat it, you hope that you can get pregnant afterwards. But some of these diagnoses that you identify are not necessarily easy to treat and don't necessarily lead to a successful pregnancy. So, for instance, endometriosis sometimes is treatable and may lead to a successful pregnancy, but oftentimes it can have associated issues like low ovarian reserve or low egg quality. And so definitely we don't necessarily think that having unexplained infertility is a doomsday diagnosis. So what does that mean? When I see unexplained infertility, I think of, well, at least we've got eggs, at least we've got sperm, and there's a high chance that that couple has an opportunity for success. So doing treatment is kind of the next step. And so that might mean starting with low-tech treatments like giving the woman some ovulatory medication and then doing insemination, bringing the sperm and doing intrauterine insemination, or moving on to in vitro fertilization depending on the couple's age and what their goals are. So in vitro fertilization involves taking the eggs and the sperm and combining them in the laboratory. Sometimes through that in vitro fertilization, you might discover what the problem was. You might discover that the egg and the sperm were having issues meeting inside the body, or you might discover that there was lower than expected embryo quality, and that's why the couple was having trouble. So unexplained infertility with our traditional testing using external blood tests and X-ray and ultrasound may not discover the problem, but in vitro fertilization, even though we're doing it for treatment, might be a discoverable diagnostic test as well. So unexplained may discover through more advanced treatments that the cause was related to embryo quality potentially, or to the egg and the sperm actually being able to meet inside the body. So the other thing we know about unexplained infertility is that if you have a couple who has unexplained infertility, that couple, if they enter treatment, have a much higher chance of getting pregnant in the next year than a couple who's diagnosed with unexplained infertility who continues to try to get pregnant without treatment. And you'll see at least a 3 to 4 times higher pregnancy rate among the couple who seeks treatment. That's really important information to have, especially if they do more advanced treatments. If they do something like in vitro, those success rates even go up higher, and in particular if they're younger. So waiting until you're much older to consider treatment for unexplained infertility is not an advantage, it actually puts you at a disadvantage. So seeking treatment early and at least getting a diagnosis early if possible is important because it limits the number of treatments you need and it also gives you a higher chance of success. So I know I have a lot of patients who come in and we kind of go through the testing and they often want to have a reason why they're having trouble getting pregnant. And we call this unexplained. There is usually a reason and that reason may or may not be easily discoverable. But again, we don't always have reasons in medicine and there's definitely good treatment strategies. So please consider seeking testing and treatment and don't be too discouraged if you get the diagnosis of unexplained infertility because if you go into treatment, you're likely to get pregnant soon.